So welcome everyone, thank you for joining us. Hopefully this is a chance for you to get to hear more about the programme directly from some of the co-directors and some programme students also. Quickly to introduce myself and the other panellists. So my name is Ellie Groves, I'm the Programme Manager and Research Development Manager for the Health Data in Practice PhD programme. Today, co-directors and fellow panellists we have with us is Professor Carol Desertot, who you can hear but not quite see, hopefully yet. We have Professor Healey with us, and we have Professor Deborah Swinglehurst. Unfortunately, Professor Borislava Mihaylova can't join us today. So we have 3 out of the 4 co-directors who are going to talk and probably introduce themselves shortly. We also have 2 programme students with us today, Jinghui Law and hopefully Lizzie Renfrew will be joining us shortly, and they're going to give us a little bit of a student perspective during the webinar today. So that's a quick panellist introduction. I will hand straight over to Carol if she's ready to introduce, and we have a few slides, about 30 minutes of slides to show you, and then hopefully plenty of time for Q&A. The chat function isn't enabled, but our Q&A function is enabled today. So as you join, if you have any questions, feel free to pop those in the Q&A. We won't pause for questions during the slides, but we'll come to them towards the end and we can work through them. You can upvote, so if someone's already written a question that you would like answered, then you can upvote and they will appear at the top of our list so we can get through the most popular questions first. Other housekeeping, as you can hear, the session is being recorded, and so that's so we can circulate it to others after today. And with no further ado, I will hand over to Carol.
So I'm doing this from my phone because I've had a technical meltdown. I'm just checking, Ellie, that you can see my face because I can only see your screen.
We can see your face, Carol, thank you.
Okay, you can hear me all right. Okay, that's fine.
Yes.
So, apologies for that, and welcome everybody. It's very exciting to be recruiting what's our 4th cohort on this fantastic Health Data in Practice Wellcome PhD programme, and thank you for joining the webinar and expressing an interest in applying to our programme. Can you move the next slide on? So our vision when we set up this programme and applied to get it was really to develop future scientific leaders who would be able to apply interdisciplinary perspectives to realising the potential of health data science for the benefit of patients, the public, healthcare systems. And we have 4 key themes in our, which you're going to hear more about in our programme. And we have a really exciting offer, which Ellie's going to explain more later, which not only provides a very rich set of opportunities to be supervised and taught by some leading researchers from a whole range of disciplines, but also to provide a real important context for the way in which we look at data that draws on both the real world and on that interdisciplinary context. And all that in a university that is importantly inclusive and really promotes a positive research culture. So we hope that you'll find our offer something that attracts and interests you, and that you'll look more deeply after today's webinar at the programme. Next slide, please. Over to Pat.
Sorry, I need to unmute. So the human data interaction research thing, I think the first thing to sort of say about it is so we used to have this concept of human-computer interaction where we thought about the way in which people interact with machines, kind of discrete machines. So as in the picture, you can see people sitting at a screen. But of course, things have changed. Computing is sprinkled all throughout the universe now. So we have concepts of ubiquitous and embedded computing, the Internet of Things, embedded data. And that's led to this notion of human data interaction, where you're not really worried so much about the physical interface, but you're thinking more about how people can understand and interact with data. And so there's three underlying themes to this. The first is user-centered algorithmic design. We have these quite rich and complex ways of handling data mathematically, but then how do we interface those with users? And that raises actually the first question: who are the users? So we could think about clinicians, and that's what I think what people have typically thought about with health data. But there's also patients, carers, families, all of whom have an interest in the novel kinds of data that are being generated. And that creates a set of research questions about how you deal with that. For each of those groups of users, there is a different answer to what does the data mean. You want to know its meaning, but of course, meaning for a clinician is different from meaning for a user, for a patient or a family member. And that leads to questions, design questions, user-centered design questions about what users actually need, what is actually informative for them, and what is actionable, what can they really do with the data. And another line of research that's related to the sort of contemporary AI and machine learning technologies is making them trustworthy. So typically these algorithms are difficult to interpret. It's difficult to know what they're actually doing inside. That leads to issues of bias. So there may be bias in the data because the data is sampled from particular groups, or it may be in generalizations made by the algorithm itself, or it may be a combination of both. You need ways of thinking about, particularly in a health context, thinking about what those sources of bias might be, how you might mitigate them. Transparency, what is an algorithm actually doing computationally? That's not straightforward. And there's quite an industry of people trying to work out how to look inside these black boxes. And similarly, how to then explain what they're doing. So you may have a mathematical understanding of what the algorithm is doing, but if you're making a decision about healthcare, you need to actually be able to give a intelligible, rational explanation of how that algorithm has influenced your decision. And then the last point, which is perhaps the most obvious, protecting and respecting privacy. This data is everywhere. My phone, my watch, there's all sorts of things which are monitoring me, collecting health data. Where does the processing of that data happen? Does it happen in a centralized way, which is the typical model, or could it happen on the device? And then you only share little bits of the data that you believe you should share. We don't fully understand what's being collected. Nobody can really anticipate what inferences might be extracted from this data. And what do you want to share and who do you want to share it with seem fundamental questions for thinking about novel uses of health data. And Carol warned us to know who we're passing on to. I actually don't.
I think it's me.
Okay, Carol, thank you.
Yes, that's me. So I'm going to talk a little bit about the actionable information theme. And if you look at the cartoon on the left, this is really the three components of a learning health system. And that's really the important thing about actionable information. And the clinical effectiveness group, which I'm based in, has been using this learning health system for a couple of decades, actually, to drive up quality improvement and equity in healthcare. And we do that by taking data, and we have trusted access to data, turning that data into information and using evidence-based interventions to turn that knowledge and deliver it actionably at the point of care. And that's in a continuous cycle, because we're always learning, as Pat would have it, from our users. What are the big challenges? What are the big health issues? How can we help you work smarter and better to manage health at a population level? And then turning that into analysis and information, and then research fitting into that, really, because we can both innovate and we can also evaluate. And obviously there are some intersections with the other themes. So we put evidence into practice, but we also get evidence from practice. And some examples of our actionable innovations that have been very successful are helping the frontline healthcare workers to organize complex algorithms in a way that can help them to identify people and target people who would benefit from different types of healthcare. Some of that is risk stratification. So you may be familiar with something called QRisk, which helps to identify people who are at high risk of a heart attack or death from heart disease in the next 10 years, and to give them a set of interventions. That was sort of co-developed from this group and is now a national programme delivered as part of NHS health checks, and has been estimated to save a lot of lives. We're also interested in data across the life course. So some of the health data that we collect are used in the context of other cohort studies, such as an important one that's run from East London Genes and Health, which is aiming to understand the genetic factors in underrepresented populations and to bring that genetic data together with electronic health record to understand how risk is differentiated and how inequalities in healthcare develop across the life course. And then finally, one of the innovations we're very proud of in terms of place-based data has been developing what's effectively a natural language processing algorithm to turn the messy addresses that you find in the NHS patient addresses into a 12-digit standardized code called the unique property reference number, which can then be encrypted and can be used to link address-based data. So we're currently working with local authorities who often only have address-based data to open up a whole new raft of research based around looking at the wider determinants of health. And for example, one of my PhD students has been looking at linking it to housing data, looking at both overcrowding and energy performance of housing and how that intersects with health data. So I think there are a lot of really exciting opportunities to use data in an actionable way. And the important thing is that that makes a difference and there's very good impact, you know, from that kind of research. So lots of opportunities there. I'll hand on now to Deborah.
Hello, I'm Deborah. I'm a GP and I'm a qualitative researcher. And I have interests in how practice is done and how we use data and technologies and how these play out in practice. So the theme I lead is health data in practice. And that includes a module in our programme which focuses, in the MRes programme, which focuses on the contribution that qualitative research can make in this area. And I lead a team of researchers who use a range of innovative methodologies to explore professional practices, patient practices and interactions in health settings. And lots of these methods focus in particular on how work is done. So things like ethnographic approaches, which might include observations, interviews, images, video recordings, for example. So the work in this stream of our programme falls broadly into three sub-themes: data in use, data in practice, and the moral and ethical implications that are raised in the generation and the use of data and technologies in healthcare. So previous and ongoing projects in this area have included things such as studies of electronic records, coding practices, repeat prescribing as a technology-supported routine, remote consulting in primary care, the use of technologies such as dosette boxes and robots in polypharmacy, and also an ongoing study on how scholars collaborate to create an AI technology. So how is interdisciplinary work done in that field? And we have studies on how health policies play out, such as nationally mandated child measurement programs and other kinds of expert system. So when technologies are introduced, practices, working practices and patients' practices are changed very profoundly. And as we've heard, one of the things that happens is that life gets categorized, it gets standardized and organized in quite particular ways. And these processes are of real interest to social scientists, because how we organise, label and categorise has moral consequences and shifts how work is done. Furthermore, technologies have embedded inside them a range of assumptions about how the world is imagined to be, but these assumptions rarely quite align with how practice plays out. So again, that raises some interesting areas for qualitative research. So technologies get used, they get resisted, they get worked around, they get abandoned, and they get appropriated in different ways. So what looks like the same technology or the same approach to gathering data or generating data can shift and be very different in very different local contexts. This raises lots of interesting qualitative questions. There are always questions of trust, risk, uncertainty, and questions of who is responsible. And as Pat was saying, in a world where data is increasingly distributed, what are the implications of that for how trust and responsibility and so on is worked out? So there's great scope for extending research on the relationship between technologies, health and society. It's very common for data to be viewed through a technical lens, but data and technologies never act alone. And if we're going to get the full benefits of data science, then we really need to study data in its context of use. So qualitative research has an enormous contribution to make to this area. And if that's something that interests you, we would also love to hear from you and love you to join our programme. And I'm sorry, I can't remember who I'm handing over to either.
I think it's me again.
Thank you.
Good. Great. So in Boby's absence, I'm going to talk a little bit about the research theme, effective and efficient evaluation. And Professor Mihaylova is a very eminent health economist who is really supporting this programme as part of a group who really work on the methodologies of clinical trials and how to use and incorporate health data in practice in terms of achieving what we all want, which is a maximally efficient evaluation, but also one that is least biased. And this spans work that can involve randomization of methods using routine health data at the individual level, but in particular, a great expertise in different designs using cluster randomized trials where the unit of intervention might be an organization and the intervention might be scaled using different designs, including something called a stepped wedge design. And Richard Hooper, who's one of the proponents of this, has a very nice website called Stepped Wedgehog, which I'm sure you'll enjoy looking with lots of examples if you're interested in this. Importantly, where trials have originally just perhaps evaluated a medicine, now what we're needing to do is to get robust evidence that with more complex interventions that we're doing more good than harm. And some of those can be evaluated in a randomized method, which is our most robust method, but many of those may require observational data and different statistical methods to look at the, for example, before and after, so things like time series analysis, join point, Bayesian methods, and so on. What we're seeing increasingly is that needs to work across with social science, really, to understand the processes and the fidelity, if you like, to using some of these more complex interventions. And then at the bottom of the list, but not least, is, you know, does this help the health service, or does it help us to work more efficiently? I'm sure you don't need reminding why that's important at the moment. And does it help us work more effectively, and are these generalizable? So there are a lot of things in the causal inference and economic box which are very exciting research questions, and particularly economic evaluations, which can help us understand impacts in terms of patient-reported outcomes, quality of life outcomes, where we're bringing in data that may be actually collected by patients themselves, again, showing another important interface that we're able to move forward using some of these ubiquitous digital collections that Pat referred to earlier, and incorporating those into the kind of outcomes that we want to seek to influence that perhaps our patients value more. So I just flag that across all 4 themes, patient involvement is a key, and co-production is a key sort of underpinning element, and we have quite a lot of expertise in our institute in supporting that, and quite a lot of exciting opportunities to have impact with your research through public engagement through Queen Mary's Centre for Public Engagement, which has I think one of the only, is it platinum or gold awards for public engagement? Anyhow, the universities, anyhow, it's very good.
Platinum.
So platinum, yeah. Okay, thanks for that correction. So I'll hand on now, I think, to Ellie. Back to Ellie, is that right?
I believe so, yes. Thank you, Carol. So I'm just going to talk through some of the key features of our programme that will probably be most of interest to those of you joining us. So to speak to the programme structure, it's a 1+3 programme, which means its first year of the programme is a Masters in Research in Health Data in Practice. So that has both taught elements and a dissertation element, which I'll go into in a little bit more detail. The years 2 to 4 are the encompass the PhD project, and our current model is that students co-develop their PhD project alongside their chosen supervisors during that first year. There is also an option for the Wellcome Trust funded programme of career transition support. So this is something called the Transition Fund, which I'll touch on in a little bit more detail, which would be open to students to apply to as effectively follow-on transition funding post-submission. In terms of the support that's available through this programme to students holding the studentships, this would be a stipend for all 4 years. That's set at a particular rate set by the Wellcome Trust, and that starts at £22,000, just over £22,000 per annum. And increases year on year over the 4 years. If you want to know more detail about that, you can go ahead and look on the Wellcome Trust website. It has all the breakdown of those stipend costs. Also covered as part of the studentships are PhD registration fees across all 4 years at the UK home rate. This should no longer say EU, unfortunately, the home rate for every year of the programme. There are also research expenses, so every studentship attracts a research budget. There's also budget for each student on to cover transferable skills training, and also travel costs for conferences and collaborative visits. So in terms of who is eligible to apply, well, our current criteria are that students should have or hold or expect to hold usually a 2:1 degree or equivalent in a relevant subject area, and you can find more details of those relevant disciplines on our website. A postgraduate degree is not required. There are minimum English language entry requirements, and unfortunately this programme is not open to clinicians or most other practicing health professionals. If you are at all unsure, please get in touch with us via the email that you can see down the bottom there, hdip-dtp@qmul.ac.uk. I have one more slide before I'm going to hand over to one of our students. So I wanted to just go into a little bit more detail about what the master's year would look like in terms of the structure of that year, because that's often something we get asked about. So it follows a taught programme kind of schedule. So there are 3 semesters across the year. In semester 1, which runs from September to January, you would be taking 3 compulsory modules, which are currently health data in practice, a module on effective and efficient evaluation, and another module on qualitative methods in health research. And then you have the option to choose from a list of possible elective modules to make up your 60 credits. I should have said there's 60 credits across each of those different semesters. In semester 2, there's a 30 credit quantitative methods and data module that's actually delivered by an associate school, so the School for Politics and International Relations. And then to make up the 60 credits, you have, again, options for electives of 15 credits each. And then the dissertation research project encompasses semester 3. So this is in itself a 60 credit module, and we put out calls for dissertation projects early on in the academic year, which the students can interact with the possible supervisors and decide on one that is of interest to them. So I'm now going to stop there and hand over to one of our current students, Xinghui Law, who entered the programme in the first cohort of students. So as Carol said, we're just recruiting now for our 4th intake. So to introduce Xinghui, she's just going to tell us a little bit about her project so far, her background, and hopefully give us a little tip or two on applying to the programme.
Hi everyone. Unfortunately, you just have me because Lizzie is running into some technical issues with joining the Zoom call. But the good news is, you know, all the details about her project and her background can really be found on the HDIP website. But hi, my name is Xinghui. So as Ellie mentioned, I'm from the 2020 cohort. So I'm right now in the 3rd year of the program, but 2nd year of my PhD. My first degree was in psychology, and then I went on to do a master's in health psychology, which is where I started to get involved in a lot of work on behavioral science and health. And when I first came across this program, what really attracted me was the emphasis really from the start on interdisciplinary research. I saw it as an opportunity both to learn new skills to deal with and analyze health data, but also an opportunity to combine it with my current academic background and hopefully engage with experts in different fields to generate interesting and unique research questions. And I definitely say that my experience so far has definitely kind of reflected that hope. In terms of my MRes dissertation, I was looking at an application that was designed to support and structure conversations in mental health care consultations for patients with psychosis. I worked with Pat, who's here in the call, on that project. And then for my PhD right now, I'm working with a large-scale genetic study on South Asian populations in the UK to explore genetic risk perceptions on type 2 diabetes. And we're also considering if tools, genetic risk estimation tools, like polygenic risk scores, can have unique potential for disease prevention and management, specifically in younger people. So I'd say there's definitely been plenty of opportunity in the program to engage in a range of qualitative and quantitative work. And in my case, this has really helped to push me to consider the in-practice application of a lot of technologies and advancements in health data science. So yes, personally, the program has been a great experience and a great fit. I think Ellie mentioned that I'm also supposed to give a few tips on putting in an application. It's a really simple but important point, I think, is really to start early. There are quite a lot of documents to kind of get into place. So making sure you have enough time to prepare is really important, both in terms of just contacting people to write your references, because people need time to prepare that kind of stuff, and also in terms of your CV and personal statement, because I always personally find it helpful to start writing something and then not look at it for a few days. And then when you revisit it, you always find new ways of rephrasing things, or you think about important points that you should have included from the start. But yes, that's start early is the message.
Xinghui, that's great. Thank you so much. Yes, and apologies that Lizzie wasn't able to join. She has having some technical issues, which we were trying to solve.
Yeah, we were trying to solve
sadly
it,
haven't been able to.
Yeah.
So you can see the QR code there. That should take you to our current projects page of the website. And there you can find much more information about all of the current students' projects who have transitioned into their PhDs. So as well as a lovely video by Xinghui here, you can scroll down and find both the first and second cohorts project details there. And there's also some lovely quotes about what they're attracted to the programme in the first place. So hopefully that will be useful to you. But for now, I will move on. I can see some of the questions being answered as we speak, which is great news. So thank you for that, panelists. So I'm going to cover very briefly before we get on to the Q&A proper about sharing some information about researcher development at Queen Mary. So really proud of the researcher development, both as part of the programme and that's offered at Queen Mary to all postgraduate research students. We run something called the Enrichment Programme, which is a programme-specific series of workshops, activities and events that aims to deliver timely academic and research skills training to the cohorts of students currently going through the programme. Open to all postgraduate researchers at Queen Mary, there's something called the QDIP, which is essentially a skills points database which all postgraduate research students accrue during their PhDs, and provided you reach enough of the skills points, you will then graduate alongside your PhD with a Q diploma. That's something that you can find more information on about rather on the Doctoral College, the Queen Mary Doctoral College website, and in the QMUL Academy website also. We have a series of student-led events, which are great. We've just got a self-started sort of social committee of the students, which we hope will be really fruitful going forward. You also, of course, have induction days, both programme inductions and also wider department and Queen Mary inductions when you start on the programme. There are postgraduate researcher cohort days. These are run by the Doctoral College for all PGR students across Queen Mary, and they're a chance for sort of, again, specific and timely research skills training, but also a chance for you to interact with the wider postgraduate research community at Queen Mary, and they're once a year. And there are also, I should say, opportunities to interact with Wellcome programme students also, which are all run independently by the Wellcome Trust. So as a member of a Wellcome Trust PhD funded programme, you would be invited to those also. I think public engagement in Queen Mary has already been covered. It's fantastic, it's a really good opportunity, and there are some funding opportunities and training offered specifically around public engagement, so really proud of that. And also to go into a little bit more detail about the Transition Fund. So this is something that the Wellcome Trust has initiated in the latest round of their funded PhD programme, so it's specific to a Wellcome Trust programme, and it's intended to provide sort of relatively short-term transition funding, so it can be salary support, training support, in order to aid your pathway to your next career step. So it's a really unique and exciting aspect of this programme. So some of the key information that I'm sure you'll be thinking about and interested in. What are we looking for in terms of the personal qualities of our programme students? Well, we really want you to sort of sell yourselves in the sense of these are the kind of aspects and qualities that we are kind of looking out for. So you need to be able to demonstrate a passion for learning. We're looking for curiosity as a key kind of personal quality. You need to be able to demonstrate critical thinking, and also team science, as this is a really interdisciplinary programme. Team science is going to be a really key factor going forward, and collaborative working. So you can find some more information about the kind of things that we would like you to include in your supporting statement and your personal statement on our website. So I highly recommend you go and find the application information page via our website, and that will tell you in more detail about the kinds of things you should consider including in your personal statement. Key dates, hopefully you know these already, but always worth reminding. So applications are currently open. The deadline for applications, we need to receive your application by the 16th of January at 5 p.m. So you have a few weeks, but don't delay. As Xinghui said, great advice to make sure you submit and prepare all the documents in good time. Interviews are currently scheduled, or are scheduled, I should say, for the 20th to the 22nd of March, and they will be held virtually. In terms of how to apply, you can find the link to apply via our website. You will need to submit CV information. Whoops, let me go back. CV information, and as I say, the personal statement is a key part of your application. You will also be asked to include at least 2 academic references, and these are really important. We can't take applications forward unless we have 2 academic references. So do make sure you include either those, upload them with your application, or include their details so they can be contacted separately. So I think what we'll do is go straight to the Q&A. So I'm going to stop sharing unless Carol or any of the panelists have anything else to add, anything you think we've missed that is important to share at this point.
Not from me, Ellie, thank you. I think that was a very comprehensive introduction. We'll just wait to see how things are going with the questions and the chat.
Absolutely. So, okay, so some of them have already been answered, so you can go through and look in the answer tabs to those. So as I say, thank you to the panelists for doing that. I'm going to sort by most upvotes in case anyone has upvoted any. It doesn't look as if they have. So the first question, I'm going to probably just hand these out to the panelists as relevant. So how competitive is the programme? Carol, do you want to take that one? It's a tricky one.
Well, I think we have recruited some excellent candidates, but I think my advice to you would be to have a big ambition, to count yourself in. And if the programme excites you, I think you can see from the slide deck that we're not just recruiting against, obviously we want academically excellent people and people who we feel are going to be able to get through and rise to the sort of challenges of an MRes and a PhD. But over and above that, what really makes people competitive is their passion and their curiosity. And so I think, bring yourself and bring that to the application, because that often differentiates people at interview very clearly. And, that drive, that desire to answer some important questions and to make a difference is often what we're looking for. I don't know if that helps, but that would be my advice. There may be some other tips from Deborah and Pat.
Anything to add there?
I thought that was a great answer, actually. So I don't think I've got anything to add. I personally am very competitive. So
I think it's inevitable that any program like this, it's an attractive program for many reasons. Hopefully that's already evident. So all attractive programs will attract good candidates, but I don't think that should dissuade anybody from applying. Apply because you're interested and because you've got something that you are really keen to explore and learn about.
And I would just add one really important point is that we really value diversity. And actually, I think QMUL has a fantastically diverse student body, staff workforce, and is improving at the leadership level. And so, we encourage people to apply from diverse backgrounds. And I would really say that's a real hallmark of our programme. And I think we have been. It's always difficult within a programme that's 6 a year to demonstrate that, but I think we have really attracted diverse applicants, and we have our student diversity and our student recruitment intake is evident, and that's not just by gender balance, by ethnicity and by people's backgrounds and their home countries, but also by their disciplinary backgrounds. So taking a very broad view about diversity, we do value that.
That's a really excellent point, Carol. Thank you to finish that question. So there's a question around just clarifying the eligibility for clinicians. So no, unfortunately, clinicians are not available, eligible to apply to this programme. However, I would suggest you go and look at some of the other PhD programmes that there are PhD programmes held at Queen Mary in health related to health data research that are open to health professionals. So I would certainly recommend that you search for some other programs open to clinicians and health professionals. That's done. So there's a specific question on a research proposal. So I perhaps should have mentioned that actually we're not at the application stage. We don't require and we don't review research proposals. As I said, research proposals, PhD proposals are co-developed during the first year. So while often students, come with areas of interest, and obviously students as Carol said, we attract applicants from very diverse disciplines. They perhaps come with some preformed ideas and interests. We really encourage them to develop those and build on their strengths, and actually further to that is to explore new areas during that first MRes year in terms of their training and their dissertation project. So actually research proposals are not part of the application process in the first instance. So I'm going to say that's answered.
Add something, please?
Yeah, of course, please do. So please jump in.
If you've got a really clear idea of what you want to do for your PhD, this isn't the right program. It's if you already know exactly what your topic is and what you're going to do for a 3-year PhD, then you should do that. And this part of the point of this program is to try and change people a bit and change their interests and introduce a more kind of wider interdisciplinary set of influences. So we sort of want to change you slightly as you go through.
Thanks, Pat. I think that's really much more eloquently put than my answer. Thank you. Great. So the next one I have on my list is there a cutoff? So the CVs you can upload a PDF, but also the application format is, there's a pro forma that you will need to complete. So CV is usually 2 pages, but you will need to make sure you can submit all the required information as part of the online application system. So
Healey, there's a hand up. I don't know if it might relate to what we just said.
Is there a hand?
Oh, it's gone. Oh, sorry.
I didn't see that, Pat. Sorry. Okay. Thanks for keeping an eye for me. So there's a couple that I'm going to type out and answer. So I'm going to hand this on over to the panelists. From the presentation, there's a sense that there is a large focus on patients and healthcare. Is there an opportunity to explore, e.g., causal inference and economic evaluations in public health interventions? I think already the answer is yes, but I'm going to throw this out to the other panelists, the co-directors, to answer in more detail.
Okay, I'll pick that one up.
Thanks, Carol.
The answer is a definite yes. I suppose the kind of background I come from and I'm a clinician by background, is population health. I'm an epidemiologist by training, and the work of our Wolfson Institute of Population Health is very much focused on improving health outcomes using a range of interventions, which can be at the person level, the place level, policy level, and evaluating those. So we work very closely with public health. In fact, in a minute, I'm just running to a meeting with our local council where we've got a £5 million joint initiative funded by the NIHR looking at the wider determinants of health. And that is going to open up huge research opportunities, working with real world data and addressing interventions that are not just at the national policy level, but also very much thinking about at the local level. So I think if you have an interest in using data for public health and population health, great scope. We have people also working on infectious diseases. We did a load of work over the pandemic using data, routine data, pivoting all our routine data to addressing and supporting the pandemic response. And one of the first papers on ethnic differences in COVID infections actually came out of Queen Mary on that. So yes.
Great, thank you, Carol. I will mark that as done. So there's a question on having had a break from academia, would this programme be suitable? I would say yes. There is no restrictions on being actively within academia or research currently. So I think that's a fair yes. Is that nods from the co-directors? Yeah, good. And then I think we've got one more question here. So interested to learn more about the research methodologies and paradigms used in different research themes. So maybe I'll throw that out to the co-directors. I know, Carol, you have to leave shortly, but before I do, there is a second part of the question, which is, will students gain exposure to other research themes and advanced learning as well, such as seminars? So the short answer to that is yes, absolutely. There's a whole, very much a culture at QMUL of research seminars. There's cross-cutting research institutes, both within this home school and beyond, so the Wolfson Institute of Population Health and beyond, so we have partner schools. For example, Pat is actually based in the Electronic Engineering and Computer Science School. So we have close relationships with the other schools, and there's a big opportunity to join a wide variety of research seminars led by academics, but also early career research groups and networks as well. So absolutely, yes. So throw that out, the first part of the question out to the co-directors, if that's okay. So Deborah, do you want to?
Yeah, I'm happy to speak to that one. So it's, I think as a participant in this programme, you get exposure to a lot of different research methods, a lot of different research methodologies, and a lot of exposure to scholars who are aligned with a range of different paradigms. So we have these different themes in the programme, but you at the outset as an MRes student, you are exposed to all of those themes. So just to be clear, you don't have to decide up front which theme that you're aligned to. The themes are there as descriptors really of the kind of range of interests that are represented. So if your interest is in straddling paradigms, learning more about paradigms, you surely will. Yes, there are many different seminars and other opportunities for you to gain additional experience over and above what you learn in the programme.
Can I just add, that's a really great answer, and I'll just add, because I think behind it might be the fact that we've emphasised a lot, if you like, the applied health research element of the programme, but that is not the only thing at all. And a lot of our PhD students are applying or developing innovative methods into answering important questions. So and there is a lot of methodological expertise. I've flagged some in the Centre for Evaluation and Methods, where there's methods development there, but we also have, in relation to causal inference, expertise in Mendelian randomization, in groups interested in emulating a clinical trial using observational data, in novel methods for economic analyses, and creating novel outcome measures and validating those, many of which might be patient valued or patient reported. So I think there's a very broad spectrum, as you're saying, to incorporate. I don't think we're a pure methods course. We're not there to just train mathematicians or in deeper methodologies of mathematics. What we want to do is to make sure that that disciplinary skill is developed in a context, and in working in interdisciplinary teams. And why do we think that? We think that because that is largely the future of many academic work in this field, is that we work in teams. It's team science, and I think the COVID pandemic showed that absolutely beautifully, that we need all disciplinary approaches to tackle some of the major problems facing our population, our country, and actually our globe in this as well. So lots of we want talent to help that, but I think it has to be talent that is able to work across those interfaces and across the intersectional boundaries that we all have to deal with.
That's great. Deborah.
I think it's fair to say that the Wolfson Institute, which is where Carol and Ellie and I are located, there's a real strength in methodological expertise, and I think that covers both quantitative and qualitative areas. So just to expand a little bit on what Carol contributed, we are that there is also scope to use lots of innovative qualitative methodologies as well, or indeed a combination, and look at mixed methods approaches. So I do think that one of the things that we really are embracing here is complexity, and how often single methods and narrow fields can't really address some of the complex issues affecting healthcare today, but by bringing lots of different paradigms, different skill sets, different methods, different scholars together, then much can be pushed forward.
That's awesome. Thank you both. And it's a really exciting time for health data research in that context way, I think. So we've only got a couple of minutes left to 1 o'clock. So I'm just going to answer this very last question that we have here. So the modules, is it regarding whether the modules will be taught online or in person? So I can tell you that now in-person teaching at Queen Mary has resumed in full. So bar the odd instance of very occasional online sessions, the teaching is all in person now on campus. Our campus is in East London. We are split between Whitechapel, Mile End, and there's a small campus in Charterhouse Square. Largely the teaching is split between Mile End and Whitechapel. So within East London. Okay, I think we've answered all of the questions in the Q&A. So given that we have only 3 minutes left, I think we'll wrap up there. Thank you to the panelists for your time. Appreciate it. Thank you for joining us, Xinghui. Really good to get a student perspective. We hope it was informative for those of you joining us, and we look forward to receiving some applications, hopefully from some of you. Thank you very much. If you have any other questions, please do check our website or get in touch via our HDIP DTP email address.